A lot of things that I've been hearing clients say recently have been my surgeon has told me not to receive any massages until 3 to 4 weeks. Well, let's talk about the reason why that's wrong. A healthcare provider can perform what is called incisional massage, which is pushing fluid out of the drains. A healthcare provider is only allowed to perform this up to 15 minutes. Anything past this is past their scope of practice. Now, if you would like to receive a lymphatic drainage massage for post-op care, you would actually have to see a massage therapist, and they are not licensed to push fluid out of the incisions. So know the difference between the two. Now, legally, can a healthcare provider charge you 85 to 200 $300 per session for 15 minutes? Yes. So try to make the best judgment that you can when it comes in that situation. And a massage therapist is not licensed to do incisional massage, remove drains, take care of wounds, tend to any kind of nursing care. So why does your surgeon say wait 2 to 3 weeks to receive these massages? Because of that fact. Because the client, the patient, you are unaware of which person to go to and what is appropriate for this situation. Medically, why do you want to receive these lymphatic massages? Because of the whole process that you're going through. The surgeon uses a cannula on the machine that is a laser that heats the fat up to 900 degrees and emulsifies it and turns it into liquid form. Once that is done, there is nothing but space that is in between the skin and the body. So your white blood cells create seroma fluid that then turns into fascia tissue, aka connective tissue, aka fibrosis scar tissue, to reconnect itself back to the body. That is the whole process of your body healing. So when I hear things like, oh, I don't want to catch fibrosis, when clients say that, there's no natural way of not catching fibrosis, because you're going to get fibrosis when you're in the kitchen using a knife to cut vegetables and you accidentally cut your finger and your finger heals. That is fibrosis, but just on a smaller scale. My job as a post-op care specialist is to maintain and minimize and control the amount of stage 3 fibrosis that you're going to have. There's 3 stages: seroma, connective tissue, healthy, and then fibrosis. So while your white blood cells are generating seroma fluid to make connective tissue to connect itself back to the body, you're going to be moving around, sleeping, putting on your faja, everyday wear and tear. Your skin is going to shift back and forth on and off the body. So fibrosis knots are going to form. My job as a post-op care specialist is to smooth out those fibrosis knots. So your post-op care specialist is going to start the massages 24 to 48 hours after the massage. And there's certain things that depend on that. How your surgery went, if you had any issues, how your healing process is, how your pain level is, and then again, with what the surgeon said to do at that time, especially when there is underlying health conditions. That's another one. But primarily, if you are a healthy body, 24 to 48 hours after the surgery is when you want to start. And then when that process comes, some go a good week, 5 to 7 days, 5 to 10 days in a row. And then they drop down to 2 to 3 times a week. And you continue that for at least like the next 4 to 5 weeks. And you want to do that because every day you're moving. Every day your skin is shifting off your body. Every day you're going to create lumps and knots, fibrosis knots, and every day they need to be broken down. So you may have some good results, but when you see girls and they stretch, or they'll have loose skin on their stomach, that's because they didn't start that process earlier. And we want you to have the best results that you're going to have. So if you're going to spend at least $5,000 to $8,000 up to $25,000 on these surgeries. Why not get the proper post-op care? And you don't doubt your surgeon. He's doing nothing but protecting you, because this is a brand new business. It's a brand new era. And there's so many people that are saying, I do lymphatic massage, and they're not licensed to do it, and they didn't take the proper schooling for it. So if you have any more questions about how many massages you should get, or questions just about your post-op care in general, you can reach out to me online, or you can get a copy of my Amazon ebook, or you could set up a consultation.